Hello, this is Dr. Stanley Lang. Welcome to this video. I'm one of the founders of Mercy Family Health and Pain Management, which is the name of our office, Mercy Family Health and Pain Management. And I want to talk to you today about chronic pain. Now, one of the reasons why we decided to sort of single out pain management from family health or family practice is because it's a special case where we can sort of treat the thing that caused the pain, and then that's really all the patient had to deal with. With our family practice, we have a kind of a cap on how many patients that we will let into the practice, so to speak. We don't want to be super busy with that, so we have a limit, and we don't exceed that limit in terms of numbers of families that we do take care of. It's a relatively small number compared to the average family doctor. I'm not saying that's good or bad, just that's what we chose to do because as I get older, I want to not work quite as hard as I did when I was a lot younger. But pain management is something that we can sort of carve out and do to help a patient for 4 to 8 visits and maybe get them over the hump without assuming all their other medical responsibilities. And so I want to talk a little bit about the non-invasive strategies that we can pursue, and that we have special resources in our office as we've opened this new office to help with people with chronic pain. So if you have chronic pain, I do recommend that you pay close attention to what I'm about to say. So for many years, as a family doctor trained in a place where family doctors did lots of stuff, where I was trained, we were trained to practice as a solo practitioner in a very remote setting. So I was very much used to interventions, and so doing injections into joints and things like that, I've done thousands and thousands of those over the years. And that's a simple way to address chronic pain in an arthritic joint, or chronic pain in soft tissue that just doesn't want to get better. Physical therapy is not helping, massage isn't helping. So steroid injections have been something that I've done for a lot of years. Well, we came across a technology that has basically caused me to set the steroid treatment option on the shelf. I'm not saying it's a bad idea, but what we're doing instead is a technology that actually induces healing of tissue that is in chronic pain. Now, it doesn't matter what the tissue is, whether it's joint, whether it's fascial, ligamentous pain, muscle pain. If it's hurting, this technology can help it. And it is a breakthrough technology that's been used for about almost 20 years for pain management, but is still minimally known. Definitely in medical circles, it's minimally known, partly because it's not reimbursed by insurance. So things that aren't reimbursed by insurance tend to not get pushed too much in the medical world, as you might have figured out by now. But it does work profoundly quickly, and for those to whom they respond, it has a very sustained response to it. It looks a lot when you're doing it. It looks a lot like an ultrasound treatment would look, but it is giving off bursts of energy about between 1 and 4 bursts per second, depending on how the doctor sets the device. And this burst of energy causes the tissue to respond with the release of chemicals right off the cell wall and RNA signaling from inside the cell that tells the body to send healing chemicals to that part of the body. And very importantly, activates stem cell migration to that area. So it's a little bit like having a stem cell injection of your own stem cells, but no shot involved, no harvesting of stem cells. You're simply attracting them to the area through the treatment. Now, when I started to study this over a year ago, the more I studied it, the more I was really enamored with it. And I decided, because I have a chronic neck injury that goes back more than 15 years, has been very disabling at times, to go try it myself. And I had simply 5 treatments, and after 5 treatments, I was way less in pain than I'd been in over a year, after having some very good treatments from some very good people, including 2 different kinds of physical therapy, 2 different types of massage, deep massage therapy with myofascial release, injection therapy, from some very good people. And in spite of their best efforts, I wasn't improving very quickly. And I had 5 treatments with this device, and within 2 months, my pain was virtually gone. Within 1 month, my pain had dramatically turned a corner. Within 2 months, my pain was virtually gone. Now, it's not totally gone, but at the time, I mean, compared to what I was experiencing, it was virtually gone. Now, that's, to me, close to miraculous in the world that I live in, of dealing with patients with chronic pain for over 40 years. And usually with patients with chronic pain, there's nothing you can do that induces healing to whatever it is that is in chronic pain, because it's worn out. And we don't have any treatments as doctors to fix what is worn out, unless it is to replace the joint. Well, we're pretty good at replacing joints if you go to a good orthopedic surgeon. I don't replace joints, obviously. So you can sort of throw water on the fire by putting a steroid shot in there. For a while, the pain is decreased, but it doesn't heal anything. It's just putting water on the fire. The fire is still going. Or you can go the next level and get one of those gel injections for several $100 or a little over $1,000. And that will put the fire out for a while for some people, but certainly not everybody. And some people will get joint replacement and they still have pain after that, because the soft tissue around the artificial joint is still very inflamed and hurting a lot. And this device addresses all of those issues. So I decided to bring it into our practice. It's going to be a core part of how we address chronic pain. Now, it's not going to be the only thing we do, but it's going to be a very unique part of our chronic pain management. And the reason, while there will not be a cap on the number of patients we see for chronic pain, because the majority of those folks are going to get better and stay better, at least for several months, maybe more than a year, depending on the condition they're dealing with, maybe forever. So we'll be able to see a lot more patients who have chronic pain issues, because we're not dealing with needing the same intensity of interaction long term. So I want you to know about this. It's called shockwave therapy. There are many devices out there that claim to be shockwave therapy, and they're not true shockwaves. So I'm not going to go into the details of that, just to say that there's only 2 companies in the United States that have established records as true shockwave therapy, and they have subtle differences. I decided to go with the company that had the best support for our patients and for our clinic, because they're otherwise pretty similar. But all the other things that call themselves shockwave are merely pretenders. And so I don't want to say negative about that, just to say it's not true shockwave. So they do have these other strategies. They do produce impulses of energy. Those impulses of energy do have a healing effect, but it's nothing at all like what a true shockwave machine is. Now, I've been in practice long enough that I was already in practice when the TENS unit was invented. And so I used the TENS unit a lot. I used it before it was only used for chronic pain. We used it for acute injuries, and it was very effective. And the TENS unit is basically little shocks, little electric shots through the skin into the deeper tissue. So bursts of energy as a treatment have been around a long time. And the TENS unit is still a very effective tool. I use them a lot still. But this is light years beyond that. And because it actually induces healing. And it's the only thing that I know of that actually induces healing in tissue that is chronically worn out. I mean, it's hurting because it's been chronically worn out and it's getting more worn out. So for many people with chronic knee pain, even people on bone-on-bone arthritis, so-called bone-on-bone arthritis, a lot of those people get better with this treatment. How could that possibly be? Well, that's because of its anti-inflammatory effect, pulling stem cells in effect, and a lot of other things I won't bore you with. Just say it works. You know, how does this work? Well, it works. So if this is something that you have as an issue, you've got chronic pain, and you want to try something that not only helps with the pain, but more importantly is restorative. You know, it helps to restore tissue, helps to restore function, then I encourage you to check out the link on this website that will be there eventually. It's not there right now. When I post this video, that link won't be there yet, but it's going to be how to sign up for a session with this. Now, it is not covered by insurance, so it's out of pocket and it's not cheap. I won't pretend that, but it, compared to the other things that people buy for pain relief, it's a bargain. And like I know from personal experience what chronic pain does to your life and how it limits you, keeps you from the things you love to do, and as the credit card commercial goes, some things are priceless, and being able to do things not being limited by pain falls into that priceless category. So I'm not going to talk about pricing here, just to say that it's out of pocket. We give an introductory treatment that is a smaller price, and then at that point you decide whether you want to do what are called protocols, which would be a series of other treatments that would enhance the effect. As I mentioned, I had 5 treatments. I would have gone for more, but I was driving 2 hours to get the treatment. That's why it was important enough to me to drive 2 hours one way to get the treatment. And I was sufficiently improved, and I knew that I was getting a device anyway. Otherwise, I would have probably gotten 2 or 3 more treatments. Does it work for everybody? Almost everybody. It has substantial improvement. Does it work at the 80% level for everybody? No. You're talking about 80% of people will get that result. And some people will be less than that, some more. But so it doesn't work for everybody, but that first time, that first treatment is kind of how you tell whether this is something that might be helpful for you. And so then you decide at that point whether to go forward with a longer term strategy. Now, I alluded to the fact that we do other things for chronic pain management, and in our office, even though we're focusing just on this discrete area for people that come for chronic pain, we will give dietary guidelines to decrease inflammation and other things like that, because they're critical for actually healing. And there are other nutritional supplement strategies that you can do, but there's not a lot of other interventions we'll be doing, at least not right at the beginning. So if you're interested in this, please let us know, and we'll figure out a way to get you scheduled for an introductory treatment. God bless, and have a great day.